Hey everybody, and welcome back to my channel. Now before we get started, I just want to say this is going to be a very adult conversation. So you might want to send the kids out of the room, or you might want to put on some headphones so mom and dad can't hear you. And what I wanted to talk about today is when I knew I was ready to get my bottom surgery. In other words, when I was ready to reconfigure my penis into a vagina, and how Disney helped me make that wish come true. Anything your heart desires will come to you. But what my heart desired was a vagina. To be honest, not all trans women want that, and that's okay. Now for me, ever since I was very young, I had an intense curiosity. And I think that curiosity was much different than the average boy has for the genitals of the opposite sex. I mean, yes, I think they're beautiful, and yes, I like having sex with them. But I also really wanted to know what it was like to have one. And I mean a lot, a whole lot. Now, of course, my curiosity was just part of an overall curiosity of what it was like to be a woman. I didn't transition to womanhood just because I wanted a vagina. Nevertheless, the fact that I didn't have one did contribute to an ever-increasing depression that I had, because I never thought that in this lifetime I would be a vagina-having woman. And I used to have these dreams, very intense dreams, that I had a woman's body. And these dreams seemed to happen about once a month, all the way into my adulthood, until I actually came out. That's not to say that I hated my penis, it was just there, and I didn't really care about it, which probably should have been a clue that I was transgender. And if before I'd been born I'd somehow been given the choice of being born in a female or male body, I'd obviously would have picked female, because I had to live throughout my entire life with a lot of complications. I mean, even something like sex was not enjoyable for me, because before my transition to my surgery, sex was actually just an exercise in pretending I had a vagina. I mean, how screwed up is that? And it was really hard to do. So once I did start my transition, it became a matter of when, not if, I was going to have bottom surgery. Because I found the further along I went in my transition, what before was like, gee, it would be really nice to have the bottom surgery one day, became an overwhelming need to have it. And it didn't matter that the rest of society saw me as a woman and I could live my life as an ordinary woman. Social transition was not enough. And I would have done anything, and I mean anything, to get that bottom surgery. It was a desperation that was so bad that when one of my transgender friends would get the bottom surgery, it would send me into an incredible tailspin. I mean, of course, I was very happy for them, but for me, I was curled up in the fetal position in my bed for 3 days. It was unbelievably painful. And once I knew that I'd reached that level, I knew that it was no longer just an optional thing, it was a necessary thing. I needed it like I needed air, and I wasn't gonna live very long without it. I know that sounds dramatic, and you might say, that's not really true, you just would have kept living. I don't think so. By then I was 40 and it felt like a race against time before I got too old to enjoy it. But really it was a race against time because these internal pressures were building and they were not going to decrease in any way. And I was afraid of what would happen if they got to be too much for me. Now around that time I also found out from a transgender friend who worked at Disney that they actually offered insurance that would cover my surgery. And all I could think of was like, what? Are you kidding me? The happiest place on earth could actually make me the happiest woman on earth? So I decided to get a job there, any job. And it was pretty easy to do because they're the largest single-site employer in the US. They have tens of thousands of jobs here in Orlando, Florida, and they're almost always hiring. So I got a job in attractions at the Magic Kingdom, and it paid like nothing. It paid less than $8 an hour, if you can believe it. And the job I got was working outside around a lot of hot, smelly cars that were always like belching fumes. It was pretty awful. It was backbreaking work. And of course I worked all kinds of crazy hours. Sometimes I didn't have 2 days off in a row. And you work weekends and you work holidays, including Thanksgiving and Christmas, because Disney is open 365 days a year. And at that time I was still living with my mom, and she was so not happy with me because she was like, we sacrificed ourselves so you can get this fancy Ivy League degree and you're working a job that anybody could do at Disney. But I knew that I had a goal. The problem really was that she didn't value that goal. And as I stood there in the line and one car went by and another car went by, I would think to myself, one car closer to my pussy, one car closer to my pussy, one car closer to my pussy. Which, you know, isn't a very Disney thought, but very true. And at first I was hired part-time, but as soon as I transferred to full-time, I was eligible for the insurance, and I got it as soon as I could. And at that point, I went straight to the little Disney Health Center that's over by Epcot, and I met with a couple of our health insurance representatives who helped me start filing the paperwork, or get the ball rolling. And I still remember that little interview, because I went in and I sat down and they asked me, so what do you want to do? And I told them. I remember there was one man and one woman. I remember the woman looking at me and saying, oh my gosh, you have to live as a man and dress like one for a year? And then we all laughed, of course, because I told them that I'd already transitioned, but I just needed the bottom surgery. And I also asked for an advocate within the insurance company because they were the ones who would actually be able to keep track of all the little details and make sure that all the I's are dotted and all the T's are crossed. But there were times that, you know, there were little struggles even with that. I remember the first thing I had to do was convince them that there wasn't a viable in-state option for the surgery I wanted. This isn't like other kinds of surgeries. There are just a few people in the entire country who do these. And I wanted my surgery done by Marci Bowers for a few reasons. One is she's one of the best, and two, she takes the insurance directly. quickly. Some of the other doctors make you put up the money first and then get reimbursed by insurance, which is probably one of the reasons why she now has a 3-year waiting list, because when I did it in mid-2011, she only had about an 11-month waiting list. Now, one of the requirements I wasn't able to get my advocate to waive was to have me get an evaluation by Dr. Bowers personally. That's not something that Dr. Bowers usually has to do, but it made me get on a plane all the way from Orlando to San Francisco. And of course, it was also an added expense, which wasn't that welcome for me, but I did it anyway because it was saving me overall a lot of money. Hours and hours to get there, and that appointment took all of about 5 minutes. I sat down in her office, we went over some of the pros and cons of things. She put me in the stirrups and she looked at me and she goes, "Yep, I can do it," and that was it. Now I'm going to describe a little bit of what they do for the surgery and some of the complications. And if you're a cisgender guy happy with his genitals, you're probably going to get a little queasy. Now what they do is they slice the penis open from about the head down, and they pretty much skin it. They take the outer skin off, and then all the inside stuff they take out, but they leave that nerve connecting all the way to the head of the penis intact. And they take parts of that penile skin to make a vaginal canal, and they take parts of the urethra, and they take parts of the scrotal tissue to also then make you the labia and the inner labia. And through the miracle of modern science, they can take the head of that penis and refashion it into a clitoris and then reposition it in the correct place. What percentage of people who have had the surgery are orgasmic afterwards, would you say?
That's been looked at in our series as well. We were well over 90%.
Now let's talk complications. There are some that can happen.
We see complications often from other surgeons, but they can happen with any surgeon. Probably the worst is just a really, really poor cosmetic result. Generally, they should have trained with somebody who does have a good reputation. Major complications, fistula is the only scary one, where there's an injury to the bladder or to the rectum or even urethra, but that's not common, less than 1%. Infection and bleeding, pretty rare. Pain with dilating, failing to dilate, stenosis, the vagina closes off completely because you haven't dilated, another real big problem. What we see more commonly are things like granulation tissue, which is treatable, fleshy red, hurts, or wound separation. As stitches dissolve, sometimes that skin can widen out.
I actually have a picture of this, but I'm not going to subject it to you. The two halves of my labial lips just started to open up like that, and I could like see in there, and it was not pretty. Now the crazy thing is that you can describe all these procedures and all these complications to a transgender woman, and she's like, yes, I still want it. Because I knew that was the case for me. But if you're not ready, you know, that's when you really have to think about it, and that's okay. For some transgender women, that's something that they never want, and that's okay too. But I was ready, and I can tell you that without a doubt, right up to this minute, I do not have one regret. I should also mention that they've actually made a lot of improvements too at Disney. One of which is that in their latest contract, everybody's going to start getting paid $15 an hour. I mean, that's great, and Disney deserves a lot of credit for that. The other thing is that when I worked there, the only transgender surgery procedures they covered was the bottom surgery. Now they cover just about anything you can think of. Breast augmentation, facial feminization surgery, hair removal. It's amazing. Disney gave me my life as it currently exists, and for that I owe them a debt of gratitude. Or at least an annual pass every once in a while. And on that note, like, share, and subscribe, and see you around the interwebs.